Today on Cancer Buzz, an award-winning program that speeds up breast cancer diagnosis and planning for treatment. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This summer, we're highlighting the 2024 ACCC Innovator Award winners. These awards, in their 14th year, recognize novel ideas and solutions that improve cancer care delivery. You can learn more about all of the 2024 winners this October at the ACCC National Oncology Conference. Today's guest joins us to talk about their innovation. A one-stop breast clinic improves time to diagnosis and patient satisfaction. Michele Brands is the Network Director of Women's Imaging at St. Luke's University Health Network, St. Luke's Cancer Care in Bethlehem, Pennsylvania.
Back in 2020, in the heat of COVID, we had the opportunity to work in partnership with GE Healthcare and Premier on creating a model in the United States that would really take a woman to rapid diagnosis for breast cancer. And, at that time, and still today, one of the greatest challenges is access to care. COVID really delayed women getting their annual screening mammogram. And so as we came out of that, women were returning to screening, but then you still had those women who were maintaining that annual screening mammogram protocol, and access really became an issue industry-wide, nationwide, for diagnostic breast imaging. And so the one-stop breast clinic was our belief that this would really help us to take those highest risk patients that we identify and get them from the diagnostic process through biopsy to pathology in 48 hours or less, so that we could really decrease the amount to diagnosis.
How did your team work together to bring about this program?
I had the privilege to spearhead this initiative for St. Luke's and worked very closely with my division chief of radiology, as well as St. Luke's senior leadership, who were very supportive of this idea that really getting a woman who is so anxious over this whole process and getting her to her results definitively within 48 hours or less. So we had the full support of our network, but it was really my privilege to work on this. At St. Luke's, and I believe most breast imaging programs, our goal is always to reduce a woman's anxiety around this process. I couldn't think of a better way to do that than to force ourselves to stop and look at every aspect of our business and how we were supporting patients, and particularly that woman who is at highest risk for being diagnosed with breast cancer.
Why do you think it's important to attend the National Oncology Conference in person?
I think we really got used to screen time with COVID, but there is nothing to replace the enthusiasm that you get when you are surrounded with like-minded, clinicians, administrators that are so passionately committed to this work that we do. And so there's nothing that can replace that through a screen. You get 10% of that. And coming live and coming together, those conversations in the coffee line, in the breakfast line, sitting in the classrooms, in the arena, there's nothing that can replace that.
Brands will present a deeper dive on the one-stop breast clinic at the ACCC 41st National Oncology Conference, held October 9th through the 11th in Minneapolis. There's a link to register in the show notes. While you're there, make sure to take a listen to the rest of our series on the ACCC Innovator Award-winning programs. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.